Hi friends, this is Dr. Ashish Taneja. Today, we're going to discuss about some of the DNB questions that have been asked pertaining to arthroplasty. So let's start. We'll have others joining soon. They'll catch up. So these are the few questions that we were going to discuss. So I'll go one by one. The first question was regarding the articular cartilage, the layers of articular cartilage. As you know, articular cartilage is a hyaline cartilage, and its main purpose is to decrease friction and to distribute load. And the cartilage contents are divided into two parts. One is the chondrocytes, that is the cell part, and the second is the extracellular matrix, which is made up of proteoglycans, which is mainly aggrecan, collagen, mainly type 2, and other proteins plus water. So these are the main contents of the cartilage. Collagen makes up to 10 to 20% of total cartilage mass. It is type 2 mainly. The function is mainly to provide a framework and give tensile strength. Other collagen types will be 5, 6, 9, 10, 11. So these are types, but main one is type 2. Besides collagen, cartilage will contain proteoglycans as well, which will make up 10 to 15% of cartilage mass. Its function is to provide compressive strength and keep the water intact in the cartilage. The most important proteoglycan is aggrecan, which is responsible for the hydrophilic nature of the proteoglycan. Proteoglycan is mainly made up of glycosaminoglycans units. It can be chondroitin sulfate or keratin sulfate. Besides this, there can be other non-collagenous proteins as well. Amongst chondrocytes have the main role of producing collagen, proteoglycans, and other enzymes that derive from chondroblast, and their metabolism is mainly affected both by mechanical stimuli, which can be mechanical load, pressure changes, or chemical stimuli. So mainly all these stimuli or all the factors which cause osteoarthritis do have their effect on chondrocytes. What are the layers of cartilage? The cartilage is divided into mainly 4 layers: superficial, middle, deep layer, and the final calcified zone. After that comes the subchondral bone. The difference is mainly in the alignment of chondrocytes and alignment of the collagen. See the way collagen is aligned and the chondrocytes are aligned, plus somewhat the concentration of water and proteoglycans is different in different layers. Let's see how. So in superficial zone, it's also called tangential zone. It comprises of 10 to 15% of the total cartilage width. It mainly has type 2 collagen, which is parallel to the joint. It has flattened chondrocytes, condensed collagen, and sparse proteoglycans. It has the highest concentration of collagen and water and lowest concentration of proteoglycans. So it's the only zone where articular cartilage progenitor cells have been found. So the first zone, tangential zone, chondrocytes are aligned along the length, and the collagen is aligned along the length of the cartilage, plus the proteoglycans are less in this zone. The next zone is middle or intermediate zone. In this case, the cells and the collagen fibers are arranged in an oblique or random fashion. It is the thickest layer with round chondrocytes and abundant proteoglycan content. As you can see, the random arrangement of the chondrocytes and the collagen, plus the chondrocytes are more of a rounded shape, and it has high proteoglycan content. We come to the deep zone, which is a basal layer. In this, the type 2 collagen is perpendicular to the joint, and then it has highest concentration of protein. So the proteoglycans are increasing as we come down, and water is decreasing. And the chondrocytes are arranged in columns, and thus it is resistant to compression. So we'll see again, the chondrocytes are arranged in columns. The cartilage is arranged in perpendicular to the cartilage surface, and there is high proteoglycan content and less water content. Finally, we have the last calcified zone. So this calcified zone is divided by a layer called tide mark. So this divides the non-calcified cartilage from the last bit of calcified cartilage, and this is mainly found in the joint cartilage, and it is dividing the main cartilage from the cartilage which has been used to form the bone during childhood, during endochondral ossification. So this is that cartilage. So this is called tide mark. So these are the layers of the cartilage. The next question that we're going to touch upon is pathogenesis of osteoarthritis. Osteoarthritis pathogenesis involves an imbalance between the normal cartilage degradative and repair mechanisms, which results in net loss of cartilage, hypertrophy of the bone, and generation of osseous outgrowths called osteophytes. As you know, in the cartilage we have chondrocytes and ECM, the extracellular matrix, which contains all these proteins. So a lot of changes happen in the cartilage which lead to osteoarthritis eventually. So the process of cartilage loss involves morphological and metabolic changes in the chondrocytes and biochemical and structural alterations in the matrix. So what happens is the chondrocytes decrease in number and size. There is increased water content, decreased proteoglycans, and altered collagen matrix. This is what happens. So this cartilage loss leads to significant amount of friction between the two bones, which leads to inflammation in the synovium that causes pain to the nerve endings in the joint space. There are also changes in the synovial fluid, which include reduced hyaluronic acid, reduced viscosity. It reduces its chondroprotective functions. There is increase in the cartilage degenerative products in the synovial fluid, including chondroitin 6 sulfate, chondroitin 4 sulfate, and IL-6. Also, if you check the synovial fluid, there will be high concentration of inflammatory markers. So you have to understand that even osteoarthritis at the molecular level has some inflammatory pathway which is mediating this process. As you know, osteoarthritis mainly involves knees, hips, small joints of hand, facet.